Penile rehabilitation is an important part of our treatment of prostate cancer. By using methods such as the vacuum device, we can preserve the function as much as possible. A vacuum device is useful because it can be started before, it can be used during the treatment, and it can be used after. It enhances other forms of treatment that we can add to this condition. In my hands, the vacuum device is the most important aspect of penile rehabilitation.
Erectile dysfunction, like other ailments, requires some rehabilitation. When a man has a hip fracture and has his hip replaced, physical therapy is the mainstay to help provide excellent recovery and functionality after having that type of surgery. And erectile dysfunction is no different. All men need some form of rehabilitation, especially after having surgery for their prostate, which can create erectile dysfunction. ErecTech provides a vacuum pump that allows my men to achieve erections immediately after surgery, as well as help expedite the recovery of their erectile function.
A lot of doctors, there are different kind of therapies out there for rehab of the patient. People who are going for radical prostatectomies or brachytherapy or radiation. A lot of the older doctors are still giving pills, and in my experience, a lot of these patients don't buy the pills, they just can't afford them. I'm a big believer in using the vacuum device for radical prostatectomy patients. I start the therapy usually about a month afterwards. And there have been studies showing that there actually is, if you compare patients who don't use the vacuum device to those who do, that there is increase in the length of the penis, or there's less loss with the people who've had the radical prostatectomy and don't use the vacuum device.
In my mind, using the vacuum pump for most of patients with erectile dysfunction is a no-brainer. It is a non-invasive way to deliver blood flow. Whether you use it for intercourse or not, this is a way that we can preserve function. It works in almost all patients with erectile dysfunction, and again, can be used as a non-invasive approach to the treatment and preservation of erections.
I do encourage people who do buy the device to use it not only for intercourse, but to use it as like an exercise, proactive. I recommend that they use it every day. This is one area where I believe that if you, as they say, if you don't use it, you lose it, which is kind of true. The blood flow to the penis keeps the penis healthy. As we get older, there is constriction to the blood flow. The tissue is not as healthy. By using these vacuum devices or whatever else you use for ED, it encourages blood flow to the penis, keeps the tissues healthy, and allows the patient to lead a more normal sexual life.